to talk to you a little bit there, Ashley. How can Black doulas reduce the Black maternal mortality rate?
Um, I think in my work, at least, I can say personally, um, a Black doula is helpful because not only are we understanding of certain like cultural attitudes towards healthcare and experiences in healthcare, but we can also, I like to think of myself as kind of like a liaison, as like, between like a healthcare provider and a client. Meaning, so when a person is talking to their healthcare provider, sometimes there can be a bit of a disconnect and maybe information can be lost. And so I like to think of myself as kind of the translator between the two that can help advocate for people to like make the decisions that are best for them, to remember to ask the questions that they want and need to ask, to also help remind providers to explain what they're saying, maybe, and like more common language, those sorts of things. A doula is a non-medical professional who helps support emotionally, in some ways physically, in terms like when we talk about like non-medical like pain management, meaning like I would do like counter pressure massage, those sorts of things, for a person who is experiencing labor. So I support emotionally, in some ways physically and educationally, for pregnant and birthing people in both the prenatal experience, the birthing experience, and the postpartum experience. Yes.
So it sounds like you are the perfect coach to an often stressful part of that's associated with pregnancy. How come doulas aren't offered to every pregnant woman?
I think that there's been a lot of I'm trying to choose my words carefully here.
Oh, take your time.
I think that the idea of a doula is kind of presented to much more privileged people. So like, we saw a lot of celebrities talking about their doulas, and, people with a higher kind of socioeconomic status, and especially white women talking about the privilege of having a doula. And so because of that, because of the way like that the doula profession hit the mainstream, I think that it appears really inaccessible to a lot of people. And I want to be clear that that the right doula for you would not be inaccessible. Like, for instance, there are only 4 Black doulas that I know of in the state of Utah, and we all work on, like sliding scale basis for our clients, because we understand that specifically Black women are the people who have been barred from the access, but who need it most. And so we're doing what we can to
So,
combat that inaccessibility.